Hi, how you doing? Hope you're doing well. So for today's videos, I'll talk about mental health job, specifically mental health worker, also known as mental health technician. So what is a mental health worker? So let's jump into it. So let's talk about mental health worker. A quick summary for mental health worker job is that your main duty as mental health worker is to observe and take care of physical and mental ill patient inside a hospital and mental health facility. Now for mental health facility, it could be acute to long-term stay. It depends on what area you want to work in. Personally for me, I used to work in an acute unit, so pretty much the patient come in on 5150 and they probably stay there for about 3 to 7 days, and after that they move on to a long-term care unit. Now, your main job is to observe the patient and report to the nurse any changes to their condition. So if the patient is DTS, dangerous to self, then you need to talk to the nurse. If you're DTO, then danger to other people, you need to tell the nurse. So let's say if it's inside the unit, right, the patient start acting up, have an episode, and then the patient might hurt himself, you need to report to the nurse. You need to stop the patient from hurting himself. Now, and inside the unit, as a mental health worker, you have a lot of duties. So therefore, I want to emphasize this. You're not going to do everything inside the mental health facility. Depending on your day, the nurse will delegate you to different duty. For example, I was say inside my unit, right, there was Q15, group, hallway, day room, and then activity. So there's a lot of stuff that you have to watch out for. So therefore, let's say the nurse will be like, hey, like, John, you will be at the group, and then your coworker will be doing Q15. Q15 means that every 15 minutes you have to keep track of the patient, know what they are doing, and then every 15 minutes you come back to make sure the patient is there, the patient is fine, patient is stable, patient is safe, because you don't want to lose track of your patient, and then something bad might be happening. So therefore, so let's say, for example, like at 10 a.m. So 10 a.m. you walk in, patient A is on his bed, reading a book. Okay, put that on your note. You go out, check on patient B, C, and D. Now at 10:15, so 15 minutes later, you come back and say, okay, patient A is still in his bed, but this time patient A is socializing with his roommate. Okay, you check that down, and then 15 minutes later at 10:30 you come back. Okay, patient A is not in his room anymore, but now patient A is in the day room eating. So you put that down, so patient A in day room eating. So that's how you do Q15. Now for hallway is pretty much you stand in the hallway, make sure the patient doesn't go to each other room, so just privacy issue and stuff like that. And then day room is you can have someone in the day room, make sure the patient follow the protocol policy, make sure there's nothing violent happen, make sure the patient is safe, and also assisting the group activity. So inside the mental health facility, there will be group activity, like different hours will have group activity. So for example, for adult, right, there will be group activity on drugs, alcohol, or any type of like activity involved talking about their issue. So there will be a therapist, there will be a group activity personnel. You as a mental health worker will assist that person with the running of group activity. Now sometimes as a mental health worker, you also run the group yourself, but usually this is usually only talking about the daily goal. So I have to run before. So very much example is that at the beginning of the day, you will give each patient very much a small sheet of paper, very much saying that, hey, like, what's your goal for today? What you gonna do? Are you gonna harm yourself? Very much a very basic question. And at the end of the day, you as a mental health worker, you come in and just very much collect all the paper and ask them, hey, like, okay, so we're gonna do a quick group. We'll talk about how's your day went, anything you like to share. So you kind of go each one person at each time and make sure you talk about it, socializing, and get them to open up and talk about themselves. Now, those are your main job as the mental health worker. So for this job requirement, all you need is a high school diploma or something equivalent. And then you also need a CPR, BOS for healthcare provider. This one you could get through AHA, American Heart Association. I want to make sure that you have to get the BOS for healthcare provider. That's important. Now this CPR training is probably take only a day, so it's really easy to get. Most hospitals nowadays, they also want you to get MAB CPI training. So famous stands for Management of Assault Behavior. So this one, usually they require you to have it 60 days after you get hired. So most of the time you will get this training after you get hired by the hospital, and they will provide you the training. So you don't need to get it before you get applied to the job. You will get it after you get hired, and then after you do all your paperwork, and the hospital will train you how they want you to act in the assaultive behavior situation inside the hospital. So I want to make it clear, all you need to have to get this job is a high school diploma or a GED and a CPR for BOS healthcare provider. That's all you need. Alright, so let's talk about how much you can make as a mental health worker. What is a mental health worker salary? So on average for a mental health worker job is around $15 an hour. You make around $15 an hour. Again, this is based on your expertise and your area that you work at. So most of the time, you probably get paid around $11 to $20. Again, that's a big range, right? $11 to $20 an hour. But as a mental health worker, you work in different environment, different setting. So some mental facility will require you to do more. So if they require you to do more than the average mental health worker, you get paid more. So therefore, you get the range between $11 to $20. Personally, for me, when I used to work in the mental health hospital, I get paid, I think, $13.25. But I get pay raise when I work graveyard shift. So 7 p.m. to 7 a.m. $13.25 is raised up to $14 if I work 7 p.m. to 7 a.m. 12-hour graveyard. So this is a few years ago. Now the average is around $14 to $15. So expect that to be your average pay an hour. For annual pay, your annual pay is probably going to be around $32,000 on average. $32,000 on average. But for the range wise, it's probably between $24,000 to $44,000 a year, based on your experience and based on your area that you work at. This job is a really good entry-level job for mental health setting. If you are interested in working into mental health specialty, I really recommend you this job. As a mental health worker, you literally one of the crucial part in the mental health setting. You assist the nurse, you also have a front line talking to the patient, interact with the patient. And honestly, like, if you are new to a mental health setting and you want to get your foot in the door, this is a good job. Because when I was a mental health worker inside a hospital, my coworker actually was 18 years old. He just graduated from high school and he already got a job as a mental health worker. And he was excited, like, this is a good job. But again, this is a very demanding job also, because this require a lot out of you. Because again, this is a mental health job. You work in a mental health setting. Most time you will work in a mental health hospital. So you will interact with different type of patient and different type of individual who have different type of mental health illness. So most time they will be difficult to handle, but it should take experience to talk and interact with them to help calm them down. Now, this is a good job, and I really do recommend it if you want to go into a mental health setting, because I know some people who become mental health worker and after that they transition to become a nurse or eventually become a therapist, because you literally are on the front line working with a mental health patient. Well, I hope you learned something new from this video. What is your thought on the mental health job? Let me know by commenting down below, and like and subscribe. On this channel, I talk about my life experiences and my journey in healthcare. Well, I hope you have a good day. Take care of yourself, believe in yourself, trust yourself, and love yourself. And I will see you again on the next video. Bye. Take care.